Toxic ingestions or ingestions in general are a big source of confusion. There's so many choices, it's not clear what to do. So I'm going to make this very simple for you. I'm going to talk about a few basics that everybody needs to know. Then I'm going to just go over maybe 6 or 7 ingestions and their antidotes, and then indications for invasive procedures. So airway and breathing always takes precedent over anything else. Activated charcoal is a common choice, common antidote given for most ingestions, and the important thing is that the patient is awake and alert, and the ingestion happened recently within 1 or 2 hours. If the patient activated charcoal can also be given if the patient has already been intubated, and you can give it through a nasogastric tube. So either the airway has to be protected because they're awake and alert, or they have to be intubated. The important thing about activated charcoal is that it doesn't work for ionic compounds, and the most important ones are lithium and iron that you have to know about. The other thing about activated charcoal is that if it's a caustic ingestion such as bleach or lye, you shouldn't give activated charcoal because it obscures the lining of the intestine or the esophagus, and in these cases you want to do an early endoscopy to see what the extent of damage is, and so you don't want to do activated charcoal. And finally, the other thing is whole bowel irrigation. It's useful for things which don't respond to activated charcoal, like lithium, iron, potassium, or extended release medications. Iron especially can kill you, and you want to prevent much of it from being absorbed. Forced vomiting or gastric lavage seldom are correct answers for the exam. Okay, so I'm going to go over a few specific ingestions. So the first ingestion, a 25-year-old patient with depression presents to the ER 12 hours after an ingestion. ALT is 1,000. What's the diagnosis? So it's acetaminophen, or also known as Tylenol, also known as paracetamol outside of the United States. So for acetaminophen ingestion, you want to give N-acetylcysteine even before waiting for the labs. Pattern of liver injury, it's hepatocellular rather than cholestatic with ALT above 1,000. And then just an important fact to know is that it causes central lobular necrosis in zone 3. Okay, another ingestion, 25-year-old patient with bipolar disorder presents with nausea, confusion, and ataxia. What is the diagnosis? So it's lithium toxicity. So lithium toxicity, you got to suspect this in a patient with bipolar disorder who has a triad of GI symptoms plus CNS symptoms plus altered mental status. So GI symptoms in this case are nausea, CNS symptoms are ataxia, and then altered mental status. Important thing to note about lithium is that you don't have to have an overdose to have toxicity. You can have like dehydration from vomiting or diarrhea or diuretics. And then, ACE inhibitors or NSAIDs can also precipitate it. The toxicity is related to poor renal clearance, which results in toxic levels, and the treatment is dialysis. 25-year-old with depression presents with confusion, tachycardia, and dry mouth. QRS duration on the ECG is 150. What is the most likely diagnosis? So most likely diagnosis is TCA toxicity. So you have combined anticholinergic, which is the confusion, tachycardia, and dry mouth, with the QRS duration, and that's a classic for TCA toxicity. Important TCAs to know are imipramine, decimipramine, amitriptyline, and nortriptyline. So just an important thing about tricyclic antidepressants is that the cardiac toxicity causes arrhythmias, and that's due to sodium channel blockade from the tricyclic, and the treatment is sodium bicarbonate. Okay, another example, 25-year-old woman with depression presents with fever and ringing in the ears. ABG is 7.4, PaO2 is normal, PCO2 is 30, bicarbonate is 18. So if it was a pure metabolic acidosis, the bicarbonate, the PCO2 would be the pH would not be normal. It's sort of pseudo-normalized. So you have a combined respiratory alkalosis where the PCO2 is low, and a combined metabolic acidosis where the bicarbonate is low. And so that's a hallmark of salicylates. The treatment is sodium bicarbonate or dialysis. 25-year-old patient with depression presents with lethargy. ALT is 1,000. Patient is also vomiting blood. Serum bicarbonate on laboratory is 18 milliequivalents per liter. So here you have elevated LFTs, but you also have vomiting of blood and acidosis. And so that is characteristic of iron overdose. And that happens more common in children than in adults. And the treatment is deferoxamine. And I talked about it before, but if you identify iron tablets on the radiographs, you want to do whole bowel irrigation for these patients to prevent iron absorption. 25-year-old patient with depression presents with lethargy, hypotension, and sinus bradycardia with heart rate of 30 beats per minute. So you have hypotension and bradycardia, they overdose. So what is it? It's either beta blocker or calcium channel blocker overdose. And how do you tell which one? So beta blockers, they have hypoglycemia. Calcium channel blockers, they have hyperglycemia. And the antidotes for these are glucagon for beta blockers, and for calcium channel blockers, you give high-dose insulin with glucose. Okay, a 25-year-old homeless patient presents with altered mental status. pH is low, bicarbonate is low, bicarbonate is low, PCO2 is low. Anion gap is 24, plasma osmolality normal. The maximum is around 295 to 300, so clearly there's a gap over here. So you have metabolic acidosis with osmolar gap. So this is probably a toxic alcohol ingestion, either methanol or ethylene glycol. So how do you tell if it's which one? Methyl alcohol, you get blindness due to optic nerve and retinal involvement from formic acid. Ethylene glycol, you get renal failure and stones due to oxalic acid. So antidote is fomepizole, which is an alcohol dehydrogenase inhibitor, or dialysis. Okay, it's just summary of the ingestion. So not many. Acetaminophen, lithium, TCA, salicylates, iron, beta blocker, calcium channel blockers, methanol, and ethylene glycol. And so then the final point over here is when to proceed with endoscopy or surgery. So caustics, bleach, sodium hydroxide and lye, batteries, especially the coin batteries in kids, magnets, and sharp objects. And that's basically it for the lecture. And if you're struggling with Step 2 CK studying and want to discuss strategy, please email me at dr.k at medexamcoach.com. It's dr.k with a period between doctor and K. I have a free 500 question knowledge builder in the link in the description, or you can copy this link. And any comments appreciated on what other areas to cover for future lectures. Thank you.